This episode is brought to you by Seed's DSO1 Daily Symbiotic, a 2-in-1 probiotic and prebiotic formulated with 24 clinically and scientifically studied strains to support healthy regularity and your gut, immune, and skin health. Optimize your gut health. Visit seed.com/Spotify with code Spotify for 30% off your first month of Seed's DSO1 Daily Symbiotic. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
One role of affirmative action was to improve minorities' access to higher education. It allowed colleges to consider a person's race when looking at potential applicants, which is a topic that's been debated for decades. This past June, the United States Supreme Court overturned affirmative action. This means that colleges and universities can no longer grant special consideration to applicants based on race. Many college administrators are concerned that because of this ruling, fewer minorities will gain admission to institutions of higher learning. This is especially troubling for medical schools. Currently, healthcare professionals in the U.S. don't accurately represent our nation's diverse population. This inequity often leads to poor health outcomes for minorities. And if fewer people of color are entering medical school, experts say this problem will only worsen.
Data has shown that Black patients who have Black physicians are more satisfied with their care. They're more likely to have better communication as well as comprehension with their doctor, and they're more likely to continue with care and do preventative services such as vaccines, mammograms, colonoscopies. There was even an article that was published this year that showed that when there's a greater representation of Black primary care physicians in a community, the mortality of Black patients were improved.
That's Dr. Dale Davenport, Associate Dean for Health, Equity, Diversity, and Inclusion at the Pritzker School of Medicine. She's also an emergency medicine physician at the University of Chicago Medical Center. Davenport says she's disappointed in the Supreme Court's recent decision to ban affirmative action.
Research has shown that a decrease in health disparities occurs when minority patients are treated by a racially diverse team, or even by doctors who are not minorities, but who trained in environments that gave them diverse professional or educational environments. So diversity isn't important just because minority patients have a greater likelihood of positive medical outcomes for minority patients, but because all physicians become better doctors in diverse environments. Affirmative action has had a positive impact on diversity in undergraduate and medical schools. And we also know that states that have banned race-conscious admissions have seen the number of minority medical students plummet. Racial and ethnic diversity in educational settings, as I've said, is necessary to decrease health inequities. And so this ruling has made that harder.
Schools are still allowed to consider how an applicant's race has affected their life, but it can't be a main reason for acceptance. While this most recent Supreme Court decision covers all higher education institutions, some medical schools in the U.S. have been dealing with affirmative action bans for decades. For example, in 1996, California voters approved a ban on affirmative action at public universities. Today, however, Dr. Mark Henderson says the student body at the University of California, Davis Medical School has one of the most diverse campuses in the nation.
If you go back to the post-Proposition 209 days, which is the affirmative action ban in our state, the ethnic and racial representation of the public universities did fall dramatically across the University of California, including at UC Davis. So when I took over this job in 2006 as Dean of Admissions, the percentage of students coming from the Latino or Hispanic and African American communities was around 10%, is what I recall, 10 to 12%. Today, again, the representation of African Americans, of Latinos or Hispanics, and American Indian or Alaska Natives is around 45%. So the proportion has tripled in the last 15 to 17 years.
Henderson is a professor of internal medicine and associate dean for admissions at UC Davis School of Medicine. He says they've achieved greater diversity, not by focusing on race, but instead concentrating on economic disadvantage.
We tend to, again, look at where people come from in terms of where they grew up, the community they grew up in, and then we use a novel scale that we've developed that tends to incorporate socioeconomic variables that are present in the medical school application, such as parental income and education, growing up in an underserved area, and other socioeconomic barriers that we feel, because we feel that the ability to overcome such barriers reflects some really important qualities like grit, resilience, and the ability to connect with patients from all walks of life.
Which is the overall mission of healthcare physicians. Dr. Jeffrey Young is the Senior Director for Transforming the Healthcare Workforce at the Association of American Medical Colleges. He says in the wake of the recent ban, college admission policies must continue to emphasize what's known as holistic review.
Holistic review really is a flexible, individualized way of assessing an applicant's capabilities. So it looks at the whole person, and it then balances, if you will, that learner's experiences, attributes, and academic metrics, and also thinks about how an individual might contribute to a school's mission and goals in a learning environment.
That being said, Young believes the Supreme Court ruling is short-sighted. But as we mentioned earlier, applicants can still discuss how race has played a part in their lives.
What the decision continues to permit is that an applicant can talk about his or her lived experiences and how their lived experiences influences their motivation, their passion to really pursue medicine. So as an African-American male, I could talk about potentially the impact of coming from a school system that had inequities. I could talk about potentially growing up in a medically underserved environment where I witnessed not only family, but community really suffer from having equitable access to healthcare.
However, the affirmative action ban isn't the only barrier for minorities. The Education Data Initiative reports that the average cost of medical school in 2023 is well over $200,000. And though the court's decision currently only affects admissions, many universities are worried about the future of race-based scholarships, which have aimed to help people of color from financially disadvantaged backgrounds.
At the AAMC, at the Association of American Medical Colleges, we do collect a lot of data. And one of the things that we see over the years is that those that apply and matriculate to medical school tend to come from the upper 2 quintiles of the socioeconomic status. So what that means is that a particular, very small portion of the U.S. population get to go to medical school.
If you look across the medical schools in the United States, you look at their family income levels of the students, about half of the students come from the upper 20th percentile of income. Only about 5% come from the lowest 20th percentile. So 50% from the upper echelons, if you will, of income, 5% from the lowest. That's a tenfold difference, if you will, between the wealthy and the poor. Well, that, to me, is not right.
Davenport says economic representation requires a strong financial commitment on the part of medical schools to enroll students who lack socioeconomic privilege.
All schools, not just Pritzker, need to look at their mission, and if they are truly thinking that they want to support their mission and decrease disparities and increase health equity, they have to put their money where their mouth is. So that includes looking at the cost of admissions, looking at the cost of interviewing, looking at how they are retaining these students once they're there.
Now that affirmative action is banned, experts fear that many qualified minority candidates won't bother to apply.
We fully recognize the importance of how this decision may impact younger learners. Right? They may be discouraged, or they may feel like, well, this is a dream that I had, but if they can't consider race, what does that mean for me? And what we're saying is that we need you. Do not be discouraged.
The Supreme Court can create law that we must abide by and create limits, but students should not be limiting themselves. And diversity still is a mission for us, and that if it's the mission of other institutions, the Supreme Court can't change that. The values and the mission of the institution cannot be changed simply by a court ruling.
And as higher education works to uphold their diversity goals, the Association of American Medical Colleges hopes to inspire future physicians in grade school and high school. Young points to DeBakey High School for health professionals in Houston as a model. It partners with the Baylor School of Medicine to offer minority students an opportunity to learn about healthcare professions.
I can't, or the AAMC can't change a learner's zip code. We have to figure out ways in which we can increase access of information to those populations that are historically marginalized within this country.
The Pritzker School of Medicine in Chicago also partners with high school students in the community. Students observe in the suture and anatomy labs, and some even shadow physicians in the emergency rooms.
The students not only just seeing the patients that are there, but also seeing a good number of physicians who are working to improve the lives of the patients within that community. I think that says a lot, especially seeing physicians of color who are there and working that they can relate to, that they can see themselves in, because it's very rare that you have generational role models. Black people weren't even invited into medical schools until the 1960s. So the thought of having generations of grandparents and great-grandparents who were doing this job before you is unheard of in most of our communities. And so seeing us there, I think, is really helpful so that they can see it can be done.
You can find more information about Drs. Dale Davenport, Mark Henderson, and Jeffrey Young on our website, radiohealthjournal.org. Our writer-producer this week is Polly Hansen. Our lead producer is Kristen Farah. I'm Elizabeth Westfield.
Coming up next week on Radio Health Journal.
There's kind of more options there for men, whereas for women, this has to be done in this one way. And it's so technical and so expensive and really hard to access for so many.
The added burden of fertility preservation after a cancer diagnosis.
Then we're breaking down the facts and myths of dietary protein.
As people think about how they can incorporate protein in their diet, think long term. Don't just think in the now, think long term.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
I don't think Threads is done yet. I think they really want to go after people that are using Twitter or X.
Will Threads, the new concept by Meta, sink or swim? Then.
Right now, I'm working with a lot of recent college graduates who are having a really tough time having those informational interviews for jobs, because the idea of meeting someone new and trying to have a conversation with them seems like a boulder.
The life skills young people are lacking. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Everyone knows that putting money aside in savings is really important. But then what? Should you keep your savings locked in a CD for a higher rate or keep them liquid in a money market? Can your checking account help you save too? Or is it about creating the right combination? We believe real banking is a conversation. Let's talk about the savings options that are right for you. Learn more at sandyspringbank.com. Member FDIC.